Hello, Casibang's crew. So today we're going to do the final video in our Unit 4, our biology unit. Today we are going to talk about psychoactive drugs and the effect it has on your brain. So our objectives: identify the major psychoactive drug categories and classify specific drugs, including their psychological and physiological effects, and discuss drug dependence, addiction, tolerance, and withdrawal. Okay, so first, our definition for psychoactive drugs: a chemical substance that alters perceptions, mood, or behavior. Three very common psychoactive drugs: caffeine, alcohol, and nicotine. Okay, caffeine is the most often used psychoactive drug. So I know there's a lot of you that probably drink soda or have a cup of coffee in the morning. So yes, you are partaking of caffeine. These drugs also induce an altered state of consciousness. Okay, so let's talk about addiction first. So there's a couple of things that we're going to talk about when we talk about addiction. Physical dependence. We're going to talk about your tolerance for the drug, and we are going to talk about withdrawal symptoms if you are not taking the drug any longer. So let's start with tolerance. Okay, so our tolerance is our textbook definition here: reduced responsiveness to a drug, prompting the user to increase the dosage to achieve effects previously obtained by lower doses of the drug. So if you are coffee drinkers or if you are soda drinkers, if you feel like you cannot get moving in the morning until you have your caffeine, a lot of people feel that way. But what happens is that your body starts to produce a tolerance to the caffeine, and you have to keep taking more and more of the caffeine to get that desired effect, to get that feeling of I'm awake. So if you've noticed this, if you used to be able to get by on half a cup of coffee and now you really need a cup of coffee to get moving in the morning, you are experiencing tolerance. Here is a little diagram that shows you this idea of tolerance. Okay, withdrawal. This is the discomfort, the physical discomfort or physiological discomfort, and then psychological distress that follows when a person who is dependent on a particular drug discontinues use of that drug. Withdrawal symptoms are usually the opposite of what that drug's effect was on you. So again, let's look at caffeine. If you stop taking caffeine, you feel really tired. You might get a headache. Okay, so your withdrawal symptoms are opposite of what that drug was doing for you. We've already talked about how neurotransmitters and how certain drugs are affected in our neuron, in our synapses. And psychoactive drugs are one of the biggest agonists or antagonists that we have in our body. So the psychoactive drugs affect our synapses in 3 different ways. And we've already talked about this because we've already talked about agonists and antagonists, but they bind with the receptor sites, or they mimic like an agonist. They block the receptor site like an antagonist, or they block the neurotransmitter's ability for reuptake. Remember, we said reuptake is when the leftover neurotransmitters in the synapse are drawn back in to the sending neuron. All right, so this picture is similar to the one that I showed you when we first talked about agonists and antagonists. So here, this is where we see an agonist, where a drug is mimicking the neurotransmitter, and it fits almost 100% like this puzzle piece. The second image here is where the drug is acting like an antagonist, where it blocks the neurotransmitter. And here is an example of where it is blocking this possible reuptake. All right, so there are 4 different classifications of drugs that we are going to learn about. The first one are depressants, and exactly what it sounds like, depress, okay? It depresses or inhibits brain activity. The second category are opiates, and these are similar to morphine. They produce feelings of euphoria and help to reduce pain. The third category are stimulants. Again, exactly what it sounds like. It stimulates or excites brain activity. And then the fourth category are hallucinogens, and marijuana is in this particular category, and it distorts our sensory perceptions. There is a fifth category that we don't really talk about as far as an AP psychology, designer or club drugs, newer, maybe more modern type drugs, and they are just a variety of different psychoactive drugs. All right, so the first category, depressants. Again, drugs that reduce our neural activity and slow our body functioning. These include any kind of alcohol or sedatives. Okay, so alcohol is a central nervous system depressant. Here's a couple examples, okay? Barbiturates help to induce sleep, and then tranquilizers help to relieve anxiety. Okay, these are all forms of depressants. Alcohol, found in beer, wine, or liquor. Alcohol is the second most used psychoactive drug after caffeine. Remember, I said caffeine was the first. And alcohol tends to slow your thinking and it impairs your physical activity. Alcohol does impair certain parts of your brain that is there to help control inhibitions and to help you make proper judgments, okay? So it's affecting your frontal lobe here. So an increased amount of alcohol in your system helps or results in a loss of self-control, can sometimes lead to more aggressive behavior. And these effects of alcohol can sometimes depend on the environment that you're in or the expectations that you have. If you're at a party with a bunch of people drinking alcohol and acting really stupid, then you're more likely to act really stupid because your environment is influencing you as well. So here's an image or 2 images here of how alcohol affects your brain. So the image here on the left is a brain scan of a woman that has alcoholism. And then on the right-hand side is the scan of a woman without alcoholism. And you notice on the left-hand side, there's a lot larger black or very dark images in the brain, which is literally brain cells that are dead. Okay, so when you hear that statement of you're killing brain cells, okay, it really is true. And alcoholism, so abuse of alcohol shrinks your brain. This is fetal alcohol syndrome. So this is mom was drinking alcohol while the baby was in gestation. So again, our image on the left-hand side is a 6-week-old baby with a completely normal brain. And then a 6-week-old baby here on the right-hand side, a 6-week-old baby that has fetal alcohol syndrome. So it is extremely, extremely dangerous for pregnant moms to be drinking alcohol. It has a serious long-term, lifelong effect on the fetus. All right, so our second category, we're still in our first. We're talking about sedatives. So these are drugs that help reduce anxiety or help to induce sleep. Also called tranquilizers, Valium and Xanax are some examples of sedatives. And it also includes barbiturates and benzodiazepines. Okay, our second category, the opiates, or sometimes called narcotics. These are drugs that depress our neural activity. They can help lessen pain and anxiety and help to produce feelings of euphoria, so extreme happiness. Some of the examples of opiates are opium, that's where the name comes from, okay, morphine and heroin. We talked about endorphins. Endorphins are naturally occurring neurotransmitters, okay? These neurotransmitters are linked to pain control and to pleasure. Opiates are the man-made version of our endorphins. Okay. Morphine, strong sedative, pain-relieving drug derived from opium, works by preventing those pain neurons from firing or releasing the pain signal into the synapse. And if you have ever broken a bone or been in the hospital and had surgery, you've probably been given morphine in the hospital. It's okay in small doses, but it can be extremely addictive. And the reason it becomes addictive is because the more man-made morphine or endorphins, man-made endorphins that we have going into our body, the less our body produces the natural endorphins that we need. So then you become addicted to morphine to help you with the pain. All right, our third category of drugs are stimulants. Okay, these are drugs that excite neural activity or speed up our body functions. These include caffeine, nicotine, amphetamines, and cocaine. They are all, at the very least, mildly addictive on up to extremely addictive. Okay, caffeine, stimulant found in coffee, chocolate, tea, and soft drinks, Coke, okay, provides users with a sense of increased energy, mental alertness, and forced wakefulness. It does block the neurological receptor sites that sedate our nervous system. And like I talked about a little bit earlier, withdrawal symptoms are sleepiness, fatigue, and anxiety, insomnia, increased heart rate. All right, so another example is nicotine. Okay, these are the stimulants that are found in tobacco. So they have very similar effects like caffeine. They help to reduce fatigue, they help to reduce drowsiness, and they increase your mental alertness. It does affect various areas of the brain, like our mood, attention, and arousal. And it is very, very addictive because it doesn't stay in our body very long. Right? So it doesn't stay around very long. It is broken down in our body very quickly, which requires you needing more. All right, cocaine. Derived from the leaves of the coca plant, a version, crack, okay, which is cocaine crystals. It blocks the reuptake of certain neurotransmitters, and dependency is extremely quick and very, very severe. Places extreme strain on your cardiovascular system. Extremely dangerous drug. Amphetamines, again, stimulate neural activity, speed up body functions, associated with energy and mood changes. They include speed, uppers, or methamphetamines. And these drugs mimic adrenaline, which again is a naturally occurring substance in our body. Okay, the last category are hallucinogens or psychedelic drugs. So these are drugs that distort perception and evoke sensory images in the absence of sensory input. So you might be hearing things or you might be seeing things that are not really there. So a couple of examples of these are LSD and marijuana. So LSD is an extremely powerful hallucinogenic drug, also known as acid. Users can be extremely dangerous to themselves and others, and it is very similar to the neurotransmitter serotonin. So hallucination, okay, just to give you an idea what a hallucination is. You tend to see things like patterns and geometric forms similar to those experienced by drug users during drug-induced hallucinations. Okay, this is an example. Mexican Indians use peyote, which is a form of a hallucinogen, to create these types of embroidery here. Okay, marijuana. So when smoked, it lowers inhibitions and produces feelings of relaxation and mild euphoria. So again, happiness. It does disrupt your memory, and it can cause lung damage from actually smoking it. Withdrawal can cause insomnia, tremors, decreased appetite, anxiety. It is helpful in decreasing nausea and reducing the effects of glaucoma. So sometimes marijuana is prescribed for certain disorders. Alrighty, that is it for our drugs. We will talk a little bit more about them on Monday when we get back to school. So make sure that you are writing down any of your questions and you bring them into class on Monday. I hope everyone had a really great Thanksgiving break. See you soon. Bye.